And the diagnosis of centric bruxism, let's see if it's mild, moderate, or advanced. When you look at a mouth like this, you can't tell if it has bruxism or not. It has canine tips. Maybe you look at it and say, no, it doesn't have bruxism because there's no wear. If you still believe that, I want to tell you that there are two types of bruxism. I mentioned it at the beginning of the class. The rhythmic movement, which is the grinding movement, and the clenching, which is the centric or tonic type, is when you just clench, do this with your hand now, and do it like this. Like this. When you do this and apply force, your biceps feel it. It's as if your temporal muscle were the biceps here, see? By doing this, you will feel the temporal muscle of a patient who has centric bruxism. Tonic, it's a patient who, when you press here on the temporal muscle, it hurts. They scream in pain. And this pressure here on the temporal muscle is the second step of the differential diagnosis that I will teach during the advanced dentistry week, which is extra and intraoral evaluation. Evaluation of this musculature, which today often the dentist does not do, forgetting the head and neck musculature. So look at the 360-degree medical record. It has the right questions. You can do this on paper or via a Google Forms link for your patient to fill out at home or in the reception area. And with all this, we can then have the x-ray of bruxism. I can compare the diagnostic plate to the endodontic x-ray. It's the x-ray of bruxism. You don't do a subperiodontal scaling. You take an x-ray because you want to see where the calculus is. So I want to see what he is doing during the night. Said and done, centric bruxism. What's centric bruxism? It's where he clenches more and grinds less. Most likely associated with muscle pain. How do you know, Andrea? Because I explained to you it's bruxism. Centric. Now let's remember what her main complaint was. Muscle pain in the face. Do I need to be a TMD specialist to figure this out? No, I need to apply the 360-degree record sensitivity in the cervical region. Often this sensitivity, she might seek an endodontist or a general practitioner or a periodontist, and then you might do a graft, for example. If she has a deflection, you'll do a graft if she has a recession. Gingival, but look at the force this patient is exerting during sleep on your graft. And my question is, will the graft stay or will it necrotize? There are many causes of graft necrosis due to clenching. The patient clenches, the patient grinds, the patient doesn't stabilize. The patient has a profile I just mentioned according to the Sleep Foundation. The American Sleep Foundation, sleep deprivation means a chronic inflammatory state. How are you going to place a periodontal graft in a patient who is in a chronic inflammation? It will make everything worse. So will the implant last? Will the postoperative period be good? No, it will be bad. Can the implant fracture? It can. The implant can have difficulties in osseointegration or even in the connective graft for implantation. It can. All of this can happen, and it will happen more and more. If it hasn't happened to you yet, I'm not casting a spell that it won't, but I'm saying the chance of it happening is very high. So if you want to know more about these topics, start following me and share with more dentists.